The opioid crisis continues, and we cannot turn our back on it. In fact, we have heard anecdotally from many counties that they are seeing an increase in overdose-related trends. And at the state level, we are monitoring multiple sources of data, including 911 calls, emergency medical services transports, emergency department visits, and unfortunately, deaths from opioid use. The department is looking at hotspots occurring throughout the state that have seen these data increases and developing a plan of action to assist these counties and regions. I would like to share a few statistics regarding work done by the Opioid Command Center since it began in 2018. First, more than 47,000 doses of naloxone have been administered by emergency medical services providers. More than 5,200 cases of neonatal abstinence syndrome among infants have been reported to hospitals. There have been close to 30,000 emergency department visits for a suspected opioid overdose. There have been more than 19,000 emergency department visits for a suspected heroin overdose. Close to 5,500 birth certificates have been issued to people with the disease of addiction for free to assist in getting them into treatment. 69 epicenter alerts have been sent to counties, healthcare providers, law enforcement, recovery support specialists, and others to let them know of an increase in overdoses in a specific county in our state. And more than 44,000 people have called the Department of Drug and Alcohol Programs hotline to either get help for themselves or to seek assistance for a loved one. The opioid crisis continues. This is despite the tireless work being done by state agencies, by peer recovery specialists, by our PACMAT programs, by recovery centers, and by many others to assist those affected by the disease of addiction. In 2019, more than 4,457 Pennsylvanians lost their lives due to a drug overdose. These people had a family, friends, a job, pets, and we cannot afford to forget a single one. This number is nearly a 20% decrease from 2017, when the Opioid Command Center was created by Governor Wolf during the height of the crisis in order to respond more effectively. However, this number is also relatively flat as compared to 2018. This means, on average, nearly 12 Pennsylvanians died from a drug overdose each day in 2019. That is 12 brothers, sisters, mothers, fathers, sons, daughters, friends, and co-workers whose lives are lost due to this disease every day. 27% of the drug overdose deaths occurred among those who were 25 to 34 years of age. 26% were among those 35 to 44 years of age. 70% of the deaths were among men and 30% were among women. These are members of our community. They're vibrant people with so much to offer, but their lives were taken too soon. I cannot emphasize enough that these people are affected by a disease, and that disease is the disease of addiction. We have come so far in reducing the stigma surrounding overdoses and those with the disease of addiction, but we still have so much further to go. The impacts of COVID-19 highlight the work that still needs to be done. We have a strategic plan in place at the Command Center that will guide us through the next 2 years as we continue to fight this epidemic. We know that with the holidays of Christmas, Hanukkah, Kwanzaa, and various others approaching, it can be a difficult time for those struggling with this disease. And due to COVID-19, this year could be even more difficult. This is the time to enhance our prevention and rescue strategies to make sure this trend does not continue. We collectively need to be willing to have difficult conversations with our loved ones who've struggled or are struggling with the disease of addiction, to let them know we support them, we care about them, and we do not judge them. We must stand beside those in our community struggling with the disease of addiction and support them. We need you, citizens, friends, and family members of people with the disease of addiction to carry naloxone. You can find out more information about naloxone, the life-saving medication, and where to obtain it on our opioid data dashboard on the Department of Health website. Together, we can all help each other. Addressing the opioid crisis is a marathon and not a sprint. I've been saying this for several years now, and 2020 has proven it to be true. We're committed to finishing this marathon and committed to helping Pennsylvanians. Please know we are here for you. The Department of Drug and Alcohol Programs hotline number is 1-800-662-HELP. Treatment works and recovery is possible. I'm pleased to now introduce Secretary Jennifer Smith, Secretary of the Department of Drug and Alcohol Programs, who is joining us virtually to also speak about the ongoing opioid crisis and the stigma surrounding the disease of addiction. Secretary Smith.
Good morning. Thank you, Ray. I am Jen Smith, Secretary for Pennsylvania's Department of Drug and Alcohol Programs, and I really appreciate those who are tuning in to our message today. While the COVID-19 pandemic continues to devastate the lives of our loved ones, the opioid epidemic hasn't ended. And as Ray said, it's still very much a part of Commonwealth life. We're losing far too many Pennsylvanians to drug-related fatalities. For individuals struggling with substance use disorder, the isolating nature of the pandemic has been incredibly challenging. As you may know, recovery is based on community, creating a support system that's available to lift each other up. And for Pennsylvanians with substance use disorder, the sense of community during isolation has looked very different from traditional meetings and groups. Family, friends, and peers are now an essential support network for all individuals, but especially for an individual with substance use disorder. Each of us have a responsibility to be part of that support system for our loved ones. And it starts with recognizing substance use disorder as a disease, not a moral failing. By showing compassion to our fellow Pennsylvanians, we can give them the courage they need to seek the help that they truly deserve. In September, I had the honor of announcing the launch of our innovative behavioral change project, Life Unites Us. Life Unites Us is a unique partnership between the Wolf Administration, Penn State University, and national partners, Shatterproof and Public Good Projects. Together, we are spearheading the country's first state-driven, proven behavioral change campaign to effectively reduce stigma across the Commonwealth. So what does that mean for Pennsylvanians? Well, we know that stigma exists for individuals with substance use disorder. Stigma keeps people from reaching out. It permeates into workplace policies and into our communities. In some cases, stigma even exists within the substance use disorder recovery community, where those who use medication are often the target of stigmatizing attitudes. In addition to the stigma faced by individuals with a substance use disorder, their family members and friends also endure the negative effects of stigma. Families often suffer quietly, afraid to reach out for help. And this has to end. With the help of our partners and community organizations, Life Unites Us provides a platform for Pennsylvanians to share their stories, for effectively teaching organizations how to address stigma in their communities. And it provides data to show the change in behaviors throughout the state. More information and data on this campaign can be found at lifeunitesus.com. If each of you take away one thing from my remarks, I would hope it would be this: there is hope through the help that's available for all Pennsylvanians. Even during the pandemic, Pennsylvania's drug and alcohol treatment providers are open and operational. They have continued to rise to the challenge during this pandemic. Our providers, our clinicians, and support staff have been remarkably diligent and flexible during this continued crisis. Additionally, recovery organizations are still meeting, both in person while adhering to masking and distancing guidelines, as well as online using platforms such as Zoom and WebEx. Treatment providers and recovery organizations are utilizing telehealth services like never before to ensure that Pennsylvanians can remain engaged in services while staying safe at home. I'd like to leave you with this. For those of you struggling with substance use disorder, and for the family members of those individuals, please know there are resources for you and trained individuals to help. Pennsylvania's Get Help Now hotline is available 24 hours a day, 7 days a week, 365 days a year. That means all hours of the day and night, even throughout the holiday season. That number is 1-800-662-HELP or 1-800-662-4357. Whether you are the individual in need of services or a family member inquiring about services for yourself or your loved one, trained individuals can help navigate local resources and treatment options in your area, regardless if you are privately insured, underinsured, or uninsured. During this holiday season and beyond, I urge all Pennsylvanians to be kind to one another and to encourage our loved ones to seek resources if they are needed. Again, that Get Help Now hotline number is 1-800-662-HELP. There is absolutely no shame in seeking help to lead a happy, healthy life. Together, we will get through 2020 and be stronger for it. Thank you.
Thank you, Secretary Smith. Your words are truly appreciated. We will now take any questions. If you would like to direct your question to either myself or Secretary Smith in particular, please state who you're directing your question to when you ask it. Thank you.
Thank you, Ray. Reporters, just a note for all of you, if you mute yourself after asking the first question, we'll assume that you don't have a follow-up. And for all reporters, we are taking questions on this topic today. Our first question is Alyssa Royster from WTAJ. Alyssa, go ahead and unmute yourself.
Hi, I have no question right now.
Thank you, Alyssa. Next up is Megan Guza from the Tribune Review. Megan, go ahead and unmute yourself.
Hi, thank you so much for taking the time today. My question is probably more for Secretary Smith. I was just wondering if you could talk a little bit more about what you've been hearing from families and those who are in recovery, and if you could just talk a little bit about how something like this pandemic and the isolation that comes with it can affect someone's recovery or derail it altogether.
Sure, that's a great question, Megan. Thanks for giving me the opportunity. So, anytime you talk about affecting the employment, the transportation, the housing situation, the financial situation of an individual in recovery, you are potentially upsetting their journey to recovery. And that's because those are some of the pillars to ensuring that they can continue that journey through recovery and that they have adequate supports in place. So when we started going through the pandemic and there were limitations in place in terms of in-person meetings, when some businesses were unable to operate in the same way that they had previously, it did cause some financial hardship for folks. It did cause an inability to pay for their housing needs, and it did disrupt their ability to attend in-person meetings. And so, any changes like that can potentially be detrimental to a person in recovery. The good news is that our recovery community is so resilient, and many organizations adapted to that very quickly. They started having online meetings. When the weather was nice, they found other ways to have in-person meetings that didn't involve being indoors. And so that was great. They could have larger numbers of folks at those gatherings. And of course, there was some COVID relief packages that helped financially. But I think the real if there is a success story to all of this, I think the real success story is knowing that our community of individuals in recovery really supports each other, and they really care so much about making sure that everybody has access to the services that they really need and checking in on each other. And so they really rose to the occasion despite a lot of the limitations. And I know they've been doing a lot of outreach during the holiday season in particular, because in general, even outside the substance use disorder world, you often see depression spiking, you see suicide rates spiking towards the holiday season. And so it is a big concern headed into this time of year, especially knowing that we're seeing a resurgence in some of the COVID numbers. Folks are trying to be extra cautious and not go out if they don't need to. But of course, that causes some isolation, particularly if you live alone. It can be very, very lonely to feel as if you don't have that support system anymore. So a lot of our organizations have done extra outreach. They've added additional meeting times. They've shared cell phone numbers so that folks can call anytime they need to. So I guess if there's a success story, it's in knowing that our recovery community really cares about each other and has made the absolute most of what is an extremely challenging situation while facing the pandemic and the opioid epidemic.
Next up is Hayden Ali from CBS 21. Go ahead, Hayden.
I don't have any questions at this time.
Next up is Marilee Williams. Marilee, go ahead and unmute yourself.
Hi. So my question has to do with the birth certificate program that was mentioned earlier in the conference. I'm just curious. You mentioned that you mentioned the program. You highlighted it. What was the anticipated use of that program, and has it exceeded use? Did a lot more people access it than you were expecting?
That's a great question. Just to give some perspective, that was in Governor Wolf's first disaster declaration, was the identification of the need for people who wanting to get into a treatment program to have identification. And as we worked with our partners, including the Department of Drug and Alcohol programs, we identified that driver's licenses and birth certificates were typically two areas that were utilized frequently as definitive identification. The command center then made the determination based on the governor's disaster declaration, as well as those conversations, to allow the Department of Health to waive those fees. At the time that we made that determination, I don't believe we had a definitive number in mind. However, I will tell you the fact that close to 5,500 of these birth certificate fees have been waived since the actual beginning of our command center in 2018 is something that makes us very proud. Potentially, that means 5,500 additional people have been able to utilize this as definitive identification to get themselves into a treatment program. Again, we consider that one of our success stories from the command center.
Okay, thank you.
Next up is RJ Ahmed from the Capital Star. RJ, go ahead and unmute yourself.
I don't have any questions at this time. Thank you.
Next up is Rhonda Kaiser from WGAL. Go ahead, Rhonda.
Thank you for your time. My question is, earlier in the information, you talked about an increase in overdose trends, and you're looking at hotspots and developing an action plan. Can you elaborate on the hotspots and what kind of action plan that you're looking at?
Certainly. Great question. Thank you. Some of the data that the Opioid Command Center typically looks at on a very regular basis are data from our prescription drug monitoring program, data from our syndromic surveillance in regard to emergency department visits, as well as data from our Bureau of Emergency Medical Services in regard to 911 calls, EMS transports, and naloxone utilization. We have that data brought, and as well as additional data brought to the command center on a very frequent basis. In addition to that data, we also hear from various counties and sometimes regions in regard to what they're seeing in their particular areas and in regard to overdoses in their particular areas. When we get more definitive information about that, we work with the Department of Drug and Alcohol Programs as well as the Pennsylvania Commission on Crime and Delinquency to focus efforts there, including pushing additional naloxone, including making sure that all of the responders in those areas have all of the information they need in regard to those increases. We then typically come back to those areas in a week or two, and sometimes even less time, to assure that our efforts have worked. Thank you for that question.
I have a quick follow-up. Are you identifying any of those hotspots by location, by county specifically?
Ray, this is Jen. I have some data here in front of me. If you want me to share that, would that be okay?
Certainly. Thank you, Secretary.
Sure. As Ray mentioned, the Department of Health is able to pull some data for us, both around prescribing habits as well as emergency room visits and overdose data. So I happen to have some data in front of me around the overdose death data. Now, this information that I have is from January through June, so it doesn't include the latter half of 2020. But the counties that we saw significant increases in would have included Allegheny, Somerset, Blair, York, and Adams, and Center County. I almost missed that one.
Thank you, Secretary.
You're welcome.
Next up is Kendra Nichols from ABC 27. Go ahead, Kendra.
My question was already asked, but I do have a follow-up. You just mentioned some of the counties that were hotspots from January to June. Any idea what led to them being hotspots? Could it just have been population density, or I don't know if you can, guess, or if you have any reasons why they would be hotspots?
I think some of the areas that Secretary Smith had previously identified as areas that would impact where COVID, would impact our opioid crisis are probably our first step in that regard. But one of the things that we do is we follow up with county officials or regional officials in those areas where we're seeing increases to see what they're seeing on the ground as well. Thank you for that question.
Next up is Asha Prihar from PLS. Go ahead, Asha.
Hi, I don't have a question right now.
Okay, thank you. Next up is Eric Jenkowitz. Eric, you're saying that you don't have a mic and you don't have a question. Okay, thank you so much, Eric. Next up is Lindsay McCoy from WFMJ. Go ahead, Lindsay.
Can you hear me?
We can.
Oh, great. Okay, I've never done this, so thank you. So I was wondering, how can you characterize how significant and how concerned you are about the evolution of these hotspots that you're identifying? I know we're in the Mahoning Valley in Youngstown, but a lot of folks travel on interstates to get access to these opioids. How concerned is your office, the governor, and what are you looking at doing in the next couple of months to really pin this down?
That's a great question. I will begin and answer, and I'll ask Secretary Smith to come on board if she has anything to add. First, our level of concern in regard to the opioid crisis is an ongoing level of concern. Since the beginning of 2018, when the governor declared opioids a disaster, we've brought together 17 state-level agencies on a weekly basis to discuss hotspots like what you mentioned, various initiatives, various funding sources, and assuring that we're marshaling all of our efforts together to address this. As we identify these hotspots, as I said previously, we automatically try to pull down as much data as we can from our applicable data sources. We share this data at our command center, and we reach out to county officials. I think we have an ongoing concern regarding our opioid crisis here in Pennsylvania and the way it's impacting our citizens. Over the next few months, we have developed, in the recent past, a strategic plan for the Opioid Command Center for the next 2 years. We plan to work on that strategic plan and work from that strategic plan as we move forward. And that includes increasing press conferences just like this, assuring we have enough naloxone out there to reverse an opioid overdose, and making sure that all of our state-level agencies are reminded of the importance of our weekly opioid command center meetings and their specific initiatives. Secretary Smith, is there anything you wanted to add to that?
Yeah, sure. So in terms of identifying these areas, we use a number of different data sets. So we get information from the DEA and the state police in terms of the number of seizures that they see in certain areas. And what we've seen over time, this has proven itself nationwide, is that typically the need for treatment is a very, very close correlation to what we see in terms of drug seizures. So we can see pretty closely if we're seeing an uptick in seizures of opioids in Philadelphia. That means we're going to have a need for treatment and naloxone in Philadelphia. So we use some of that seizure data to help inform us where we're going to see some of those hotspots. And then we've got the Department of Health who's monitoring prescribing practices, who's looking at emergency room visits. And the command center has a process in place, an alert system process in place. Anytime we see a large number of overdoses being reported in a short period of time. And that alert is automatically generated and sent to law enforcement entities, to county drug and alcohol entities, to state entities. And we use those alerts to immediately trigger conversations about, hey, what's going on in this area, whether it's a county or a region, and what can we do to address it specifically? So, for example, I live in Lebanon County, and not too many months ago, there was a rash of overdoses in Lebanon County. And so immediately we were on the phone with local drug and alcohol authorities and county commissioners talking about what can we do to make sure that naloxone is out there? What can we do to advertise where people get treatment? And as a result of those conversations, they stood up a number of free naloxone drives. They advertised that. They increased advertising about how to seek help, whether it's through our hotline or through the Drug and Alcohol Authority in the county. So it's really sort of a case-by-case basis, taking a look at a bunch of different data sets. And when we see anomalies or spikes, we're immediately working with local authorities. I think in general, what we find is that folks at that local level, those single county authorities that are responsible for drug and alcohol programming in the counties, they're usually the first ones to know that something's going on, that things have started to change, more admissions to treatment, they're getting more calls to their office for help. And so it's really important that we coordinate with those county authorities to make sure that we're supporting them the best that we can to provide them the tools that they need to address those different outbreaks. So we just use lots of data from different sources. As soon as we're aware of it, we work directly with the folks who have the ability to provide the necessary services and then monitor it. And if we need to tweak our approach, we do that. If not, then we stand at the ready for wherever the data tells us to look at.
Thank you, Secretary. We have one follow-up question from Marilee Williams. Marilee, go ahead.
Hi. So I was just wondering, earlier you mentioned that when there's a hotspot, you get in touch with people in the counties. I was just wondering if you had anything specifically that you heard from people in Allegheny County about the hotspots and what they're doing, anything that you wanted to note, because it's where our station's located.
Go
ahead. I don't know anything specific to Allegheny. That's not one that I'm familiar with what those conversations looked like. But we can see if we have more information and get back to you if you'd really like to know.
Okay, that's great. Thank you.
Certainly can follow up with you on that. And thank you, Secretary Smith.
Thank you so much. That concludes today's press conference. Our next briefing will actually be at 2 o'clock this afternoon on contact tracing. A recording of this is available on pacast.com. Thank you.